Bismillah ar-Rahman ar-Rahim. My dear students of the course Biopharmaceutics and Pharmacokinetics 2, third year students, College of Pharmacy, Ajman University. Today I will introduce you to the new topic, which is, as you see here, non-linear pharmacokinetics models. طيب, when we say non-linear, of course, you remember linear, and linear represent first order kinetics. So when we say non-linear, what does that mean? Okay, we will talk about that later. What you need to be able to do is to draw the scheme. طبعا, in order to draw the scheme, we need first to know the assumptions. Assumptions that we have here, initially it will be one compartment model, okay, with non-linear metabolism as the only way of elimination. So this applies for drugs that extensively metabolized and eliminated in this way. Okay, so one compartment non-linear elimination. Okay, and then we will be able to write the differential equation. Also, we will need to understand what happens if we have a parallel pathways. Parallel pathways, يعني here we mean that a drug gets metabolized by a non-linear pathway and another pathway that is linear. So what will happen? Okay, so we are having a drug, and this drug gets eliminated by two ways. One is linear, فبالتالي we have like something like KEL, okay, and another one that is, we will talk about it, non-linear, which is controlled by two new parameters, which are Vm and Km. Okay, so how the change in concentration will look like. Okay, dCp على dt. Okay. Okay, we need to understand and define the parameters Vm and Km. What are these parameters? And at the end, we will learn about how to design and calculate appropriate dosage regimens when we have non-linear pharmacokinetics. Okay. Now, if you remember, we said initially that non-linear is different from linear. Linear means first order, full stop. But when we say non-linear, here we will talk specifically about certain cases. Then we will focus on certain cases. We will not talk about all types of non-linear pharmacokinetics. What is this case that I will talk about? A drug that may be eliminated by first order at low concentration. Okay, then if I'm giving a low dose, maybe single dose, low dose, at low concentrations بصير عندنا first order elimination. But, and this usually happens after multiple dose administration, at high concentration it follows zero order. إذن في عندنا low concentration شو بعطينا؟ first order. We high concentration بعطينا zero. In between, it's a mix. Okay, in between it will be a mix of first and zero order kinetics. Because it depends on the dose I'm giving or the concentration, this specific non-linear pharmacokinetic that we will talk about is referred to as concentration or dose-dependent kinetics. إذن we are not talking about all types of nonlinear pharmacokinetics. We will talk about specific case where the kinetic depends on the dose that I'm giving or the concentration that results. Okay? Now, for you to understand other cases, عشان نفهم, we need to know what are the other cases. We have, for example, you studied in metabolism, you studied about induction and you studied about inhibition. Induction and inhibition will cause nonlinear pharmacokinetics, but we will not talk about that. طيب, في عنا another case. This another case is referred to as chronopharmacokinetics. And what is that? Pharmacokinetics. طيب, what is this case? It's they found out that some drugs, their elimination differs. For example, during the whole day. For example, at night, the elimination is different from during the daytime when someone is active. This is referred as chrono. Chrono means time. Okay, time dependent pharmacokinetic. So it's not concentration or dose dependent kinetics. Isn't I want you to know that nonlinear pharmacokinetics refer to different things, and we will focus on the dose or concentration dependent kinetics for drugs that are extensively metabolized, يعني their main route of elimination اللي هو through the metabolism. طيب, what is this case? What happens exactly? You know that there is a limited amount of enzymes or co-substrate or cofactor required in enzymatic process. There is a limited amount in our liver, which is the main site of metabolism. صح? يعني it's not like open, we have plenty of enzymes, cofactors, etc. No, there are limited amount of such material. If the drug concentration is high, شو بصير if the drug concentration is high? The drug concentration is high, there is no sufficient enzymes that are produced to deal with the whole quantity. So it will start dealing with portion of the drug. Okay? So here we have something like saturation. في عندنا saturation في البروسيس. عشان هيك بيحكوا لها saturated metabolism. Okay? طيب, لما يصير عندنا saturated metabolism يعني we are reaching the maximum rate of metabolism. It cannot exceed. تعرفوا بالفيرست اوردر, what is in first order? انه the higher the concentration, the higher the rate of elimination. طيب, هون شو بصير في الريت of elimination? When it's saturated, it becomes constant. خلاص, بصير ثابت. And this reminds you of the zero order kinetics. Now, where did we study zero order kinetics before? We looked at that in the topic اللي هو IV infusion. Because the rate of infusion is constant, we said that this is a zero order process or zero order rate. طيب, so if the concentration of the drug is high, we might reach a situation where the metabolism rate reached its maximum rate and it will be zero order. تثبت خلاص. Okay? Maybe later I will explain this to you in some way. Okay? Now, they found that the best equation that deals with concentration or dependent concentration or dose dependent pharmacokinetics, we refer to it as Michaelis-Menten kinetic. This equation is the best equation that talks about the rate of elimination for drugs for which their pharmacokinetics are concentration or dose dependent. Okay, طيب, what is this equation? Okay, it says that the rate of metabolism, وبنفس الوقت, because here I'm saying that the drug is mainly and extensively metabolized in the liver, so mainly this will be the rate of elimination. Okay, لأنه elimination is what? إذا بتتذكروا excretion and metabolism. So we will consider that the metabolism is the whole process of elimination. So the rate of elimination is equal to Vm في concentration of the drug in the plasma divided by Km plus the concentration of the drug in the plasma. Okay, طيب, you will notice here that I don't have negative. Okay, the reason why I don't have negative here is I'm talking about elimination. I'm not talking about the rate of change in drug concentration, dCP divided by dt. If I use this one, yes, of course, with time, after I give an IV injection, with time, the concentration decreases, so it has to be negative. But here I'm looking about the outcome, elimination, which is positive. Okay, طيب, let's talk about these new parameters. Vm represents the maximum rate of metabolism. For example, I can say that the maximum rate of metabolism that can be reached بصير zero order بعدها. Okay, the maximum rate of metabolism, let's say 700 milligram per day, or 500 milligram per day, or 600 milligram per day. That is the maximum elimination rate possible. So Vm is the maximum rate of metabolism. شو اليونت تاعتها؟ The unit is the same as this unit. If this unit is in amount, and this is the usual thing, amount per time, فمعناته ال Vm will be amount per time. Okay, if this is concentration per time, Vm will be concentration per time. So Vm follows the same units of this rate. Okay, طيب, so now we know that this is the maximum possible elimination rate or metabolism rate. طيب, what about Km? Km is another constant. زي ال Vm is constant that depends on the patient and the drug. Km is a constant that depends on patient and the drug. Km is, وانتبهوا, it's a concentration. It's like Cp, but it's a constant. It's a concentration, Michaelis-Menten constant. It's a concentration that produce rate of metabolism that is half Vm. انتبهوا. إذا شو ال Km? Km is a concentration. معناته شو الوحدة? What is the unit of Km? It will be the unit of concentration, same as Cp. It's the concentration at which the rate of metabolism will be half the maximum rate. كيف هاي يعني؟ يعني for example, if we consider Cp, اللي هو concentration, not the constant, the Cp, the concentration that changes in our body based on time and the dose that we are giving. If we consider Cp to be equal to Km, لو كانت هاي Cp is equal to Km, what will happen? المفروض the rate of metabolism should be half the maximum rate. If Cp is the same as Km, شو Km? Km is the concentration at which the rate of metabolism is half the maximum rate, but it's constant. Now, if my real concentration is equal to that one, then the rate of metabolism will be half the maximum rate. طيب شوفوا هون. Let's see how is that. Okay, I can, in this case, I can write the equation as the rate of metabolism. Rate of metabolism will be equal. شوفوا هلا, now I want to draw for you. It will be equal to what? طيب ال VM في CP. Okay, now بدل CP I want to write KM. ليش؟ Because I said that my CP is equal to Km. يعني الدواء, the concentration of the drug in our plasma is equal to the constant Km. فبتصير VM في Km divided by Km plus بدي أكتب another one Km. Why? Because my concentration اللي هو CP I will consider it to be equal to the Km. وشو ال Km? Km حكينا it's the concentration at which the rate of metabolism is half the maximum rate. شو بصير عنا؟ This will be 2 km. صح؟ ف you have Vm في Km divided by 2 km. Km goes with here, بصير عنا Vm على 2 يعني half ال Vm. Okay, إذن what is Km? Km is a Michaelis-Menten constant, which is the concentration. So its unit is the same as Cp, at which the rate of metabolism is half the maximum rate. Okay. طيب, now how do we make the scheme? The scheme is that we have one compartment. Okay. And the elimination is controlled by not KL but by VM and KM. Okay, and we will see this. طيب, how the change in concentration, تغير في concentration, يعني dCP divided by dt. طبعا the first thing is that we need to add negative. طيب, how the change in concentration here will be? It will be equal to Vm في Cp divided by Km plus Cp. This is how the concentration will change here. Okay? إذا concentration will change according to this one. وهذا negative. Why? Because with time the drug goes out. يعني here we will have a negative value. The change will be negative. طيب, إذن again, what is the unit here? طبعا the unit will be concentration per time. إذن شو ال VM? VM must be concentration per time. يعني always these units here must be the same. طب وال KM وال CP they have the same units of concentration. That's why في النهاية concentration divided by concentration the units will disappear. بضل عندنا اليونت تاعت ال VM which is the same as the unit of concentration per time. طيب, the question is, if you remember, we said that at very low concentration شو بكون عندنا الkinetic? What will be the pharmacokinetic of the rate of change in drug concentration? We said it will be first order. طيب, let's see how. When we say low concentration, what do we mean? We mean that Cp اللي هو تركيز the drug concentration in the plasma is much less than Km. This is what we mean. أقل بكتير من ال Km. Because it's much less than Km, بصير عندنا Km plus Cp اللي هي في الدينومينيتور هون في الدينومينيتور بصير تقريبا equal to Km. ليش؟ because this is very small and it will not affect the overall value here because it's plus وموجود في المقام and it's plus not multiplied. Okay, so how this equation will be, if I just use here km بصير عندنا vm على km في cp. Okay, that's what we will have. شوفوا هون بصير عندنا vm divided by km multiplied في cp. طب we know that vm and km they are constant, so the division or the result from numerator divided by denominator here will be constant. This can be considered as KEL. فبصير عندنا هون في عندنا we have negative, so we have negative KEL. will KL here represent VM على KM multiplied CP, وhere we will see that we have إيش first order kinetics with one compartment model. Is that clear? إذن at low concentrations we have first order kinetics زي ما انتم شايفين. Now this situation actually applies to so many drugs. عشان هيك that's why we said the most commonly way of rate of elimination is the first order elimination. بيكون فيها CP is much less than KM. Okay, CP اللي هو بالtherapeutic window is much less than KM, فبالتالي it follows إيش first order kinetic. طيب شو الأذر كيس؟ الأذر كيس إنه CP is much larger than KM. فشو بصير عندنا ال KM plus CP؟ بتصير ال KM is negligible compared to CP, so the answer will be equals to approximately CP. Okay, طيب when Km plus Cp is equal to Cp, where is the equation? Let's say when Km plus Cp is equal to Cp, يعني I am removing this and Cp goes with Cp. In this case the rate of elimination or the rate of change in concentration will be equal to the maximum rate. معناته وصلت الماكسيمم خلاص, and it will be ايش constant. فبالتالي what is the pharmacokinetic here? Is it first order or zero order when the rate is constant? When the rate is constant it is zero order kinetic. Okay, إذن we looked at the two ways, very high concentration, very low concentration, and how the kinetic behave. Because it doesn't follow just first order, we refer to it as nonlinear pharmacokinetic. What is this specific case? This specific case is for dose or concentration dependent kinetic that follows Michaelis-Menten equation. Okay? طيب if we take, شوفوا لو أخذنا, if we take time and concentration in a normal graph paper, هاي الجراف paper. Okay, وهاي شايفين ال distances, they are normal. We will see that the first few data, they follow, because it's high concentration or high amount, because the first few data follows zero order rate. And for zero order in normal graph paper it will be a straight line زي ما انتم شايفين here. But for first order it will be ايش? Like a curve. Exponential decrease, mono exponential decay. طيب usually we know that if the slope is high, يعني كل ما كان السلوب عالي مثلا, for example like this. The higher the slope, كل ما كان the rate of elimination is higher. طبعا this is a curve, but if we look at it and we consider it to be a straight line, بنحس كأنه rate of elimination here, the apparent rate of elimination اللي هو زي KL, شكله here is faster. But in reality, no, this is not faster. This is slower than this one. Because if I want to continue with this curve, لو بدي أكمل في هذا الكيرف, لو إنها first order, it will appear to me that the drag will fall from here to here, okay, during this time. But actually, the drag fall from here to here during this time. يعني less drag has been eliminated. لو إنها first order, كان more drag would have been eliminated. But because we have zero order here, we have less drag being eliminated at the given time. For this to be much clear to you how this have higher slope, yet it is less than the first order elimination. Okay, we can do this using a simulograph paper. شوفوا هذا simulograph paper. Of course, this is not a straight line, the first few points. But if you look at them, you will find that actually this has the lower slope, واللي هو zero order, apparent lower slope, لأنه مش straight line, but when I put it in simulograph paper, it has lower slope. بينما ال first order has إيش؟ higher. يعني if I want to continue with this line, شوفوا المفروض the concentration fall from here. بينما it fall from here. يعني the amount eliminated during this time is less than what it would have been if it is first order. Okay, I hope this is clear. Now, how do I discover such thing? يعني فرضا, let's say Ala, she doesn't know if her drag is following first order or non-linear or linear, and she wants to test that. So what she did, she started giving different doses. For example, the first month she started with 100 milligram per day, okay, and then she looked at the average concentration. وإحنا بنعرف, if you know that CP average, or we can write it like this and remove this, is equal to K0. K0 شو حكينا على الكليرنس V في KL. What is K0? اللي هو بدنا نحكي لها هون dosing rate, اللي هي dose divided by tau, أو ال F في dose divided by tau. طيب, so the higher the dosing rate, the higher is the average concentration. This is the case for first order. That's why, see here, you are increasing the dose and the average concentration increases, but suddenly the increase will be non-proportional. There will be like exponential increase في average concentration. يعني it is not as simple. Let's say, for example, my concentration is 10 milligram per liter when I gave 100 milligram. So I cannot say to get 20 milligram per liter, it means I need 200 milligram. This is not simple as that, because the increase في the average concentration at steady state will not be proportional to the dosing rate, And this is an indication that I'm having non-linear pharmacokinetic. Another thing is regarding AUC. تذكروا ال AUC is equal to dose divided by V if KEL. طبعا if I have extravascular I can add F. شوفوا هاي طبعا if you multiply or if you double the dose شو بصير في ال AUC? It will double. So again here doubling the dose should result in doubling AUC. This will be only at low doses. As you increase the doses, the AUC will start to increase in non-proportional way, more than what I expect. If this happens, it means I have non-linear pharmacokinetic. And as you remember, we were talking about specifically اللي هو the dose or concentration dependent pharmacokinetic. We were specifically talking about that, and we have other types. Not only that, also let's say dose and the T half of the drug. طبعا بالfirst order the T half is constant. So as you increase the dose, it should not change the half-life of the drug. But if it follows non-linear pharmacokinetic, you will start to see an increase في the half-life of the drug, which means that the drug is staying in the body, accumulating in the body for a much longer time than what I expect. طيب. إذن the result of all that is that there is a danger of drug accumulating in the body with non-linear pharmacokinetic. The half-life increases more than what I expect because it should be constant. عندنا average concentration will be much higher than what I expect. Okay? And this can cause toxicity. The most famous example of such a drugs اللي هو الفينايتوين. إذن the most famous and common example you see in the textbooks اللي هو الفينايتون. شو المشكلة في الفينايتون؟ المشكلة the problem with phenytoin is that it has narrow therapeutic. It's a narrow therapeutic window drug. This is the problem. فبالتالي the dosing rate is very important here, and we should learn how to control it. Otherwise شو بصير عنا؟ بصير عنا much increase in concentration which is unpredictable, and we need to control this process. بصير عنا كمان, as I said, the half-life might or will increase much higher than the constant value for phenytoin. Okay? Okay, what you see here, it shows you how the doses that you give influence the elimination. شوفوا هون almost straight line, first order. بس شوفوا when the dose increased to 1000, شوفوا كيف هنا عندنا first order which is 3 hours, لكن هون عندنا 0 order. Okay, in this case the half-life is related to how much drug is in here. إذن انتبهوا إنه T half of 0 order is proportional to the concentration. يعني كل ما زاد التركيز or the dose that I am given, the half-life will increase. Okay. طيب في عنا we have another example غير الفينايتوين اللي هي salicylates. Now salicylates is metabolized by parallel pathways. If you remember in the objectives we talked about parallel pathways. When one of the pathways is controlled by Michaelis-Menten parameters, VM وال KM, while the other one is controlled by first order kinetics. ففي عنا let's say KEM. Okay, we'll call it KEM. فإذا we have first order, we have Michaelis-Menten or nonlinear pharmacokinetic. Okay, at low concentration, هذا we will consider it as a window here, one window. At low concentration they behave like first order kinetic, but as you increase the concentration here, this will start to reach the maximum value for elimination rate, while this one keeps the same as the first order kinetics. يعني the higher the concentration, the faster is the rate of elimination. So what do you think will happen? طيب شوفوا, before I talk about this parallel pathways that describe salicylate in the body, such as aspirin, let me first show you the following. Okay, okay, what do you see here? Type, you see beautiful cars. You have two cars. There is a driver in the car, and the car can take four. Each car can take 4 passengers. Okay, but we have here a bus that can take let's say 30 or more or 50 students, and we have so many of them. Okay, طيب, let's say you as students, I want to consider you as a drug. Okay, a drug in the body. ماشي? And let's say, this is just an example. Let's say that when the students want to leave to their home, okay, let's say that 20% of the students, okay, I will draw for here with this one, 20% of those who come out, they go by car. Now when I said 20%, I will consider it as 20% per hour, because the cars drop the students and then the cars come back. So every hour 20% of the students are removed. Hello? Here we will consider that 80% of the students are using buses. Okay, and we have plenty of buses here to take them home. Again, 80% per hour. So the buses take them and come back in 1 hour. Type. Let's suppose in a class there was 10 students who left the class and they want to go home. So what will happen? 2 of them will use the car, and the rest, who will 8, will use the bus. Right? طيب, in case we have 20, فمعناته 4 will use the car and 16 will use the bus. Right? There is no problem. It's like the more students, the more is the elimination. معناته we have first order, صح ولا لا? The higher the number of students, the higher is the elimination. Okay, طيب. Let me go to extreme. I have 100 students. So what you are going to say? You are going to say 20 students will go by car. This is what's supposed to happen. Okay? And 80 students will go by bus. But is this correct? Well, the cars can take 8 maximum. إذن هون عندنا وصل elimination maximum, which is 8. اللي هو عبارة عن the maximum capacity because I don't have so many cars. وهنا I reached إيش the maximum, and this is the way of يعني I have students as a drag and they are removed by cars or buses. فإذا عندنا صار عندنا شوية accumulation. إذا I will start to have accumulation. في عندي هلا 12 students okay who are not able to go by car and they have to wait more inside the class. يعني the drag needs to stay in the body because it's not able to get removed by the cars. طيب, if we go to 1000, now supposedly what we are supposing is that 200 has to go by car and 800 by bus. But what is happening here? It's only 8 are going and the remaining 192 are accumulating in the body. Okay? بينما هون it's fine. I have no problem here. طيب, if I increase it to 10,000, okay, now I have 10,000. What will happen? Supposedly we have to have 2,000 with cars and 8,000 with the buses, right? But what is happening actually? Only 8 are getting removed by car. فبصير الكار, انتبهوا, الcars will start to be negligible in the process of elimination. شوفوا هلا كيف elimination every hour. I have 8,000 going by buses and 8 only going by cars. إذن after some times I can consider this as non-existent. ما له تأثير في rate of elimination, right? So if I put whatever number here, يعني very large number, this will no longer has an effect في elimination rate and only the buses are responsible for the elimination. So what I'm trying to tell you is, at very low concentration we have first order. يعني the higher the number, the higher is the elimination rate. At much higher concentration شو بصير عنا when I increase the concentration more? بصير عنا some accumulation of the drag because this one reached the saturation. But when we go to very high concentration بصير هذا negligible and we can consider the elimination again to occur by first order. ليش? Because the other way is open and behaves like first order, while the first way اللي هي cars are negligible compared to what happens here. خلاص بصير إنه ملوش تأثير. يعني even if I consider this as zero, it will not affect what is really happening. هذا هو parallel pathway. طيب, what is the effect of that on half-life? At very low concentration, please pay attention. Now I will talk about the half-life at low concentration. At low concentration, the half-life will be constant because everything behaves like first order. طيب, بعدين when one gets saturated وبيبدأ the concentration becomes higher بصير عندنا increase في half-life. طيب, when you reach a point where this one becomes very minor compared to the other one, so I can consider it as zero and that I have like one way of elimination which is first order. We will have again constant half-life that follows first order kinetic because this one is no longer effective. What is effective is this one. طيب, هل half-life برجع, will it return the same as with low concentration? No. The half-life here will be larger than initially لأنه كان في عنا we had another way of elimination. but here it will be constant but higher than what I have initially. Okay, and this is what actually happens. شوفوا هون, this is what happens when I give a dose. What happens to the half-life? Initially it's almost constant, بعدين the half-life increases, بعدين again it becomes constant, because ايش حكينا, الميكاليس مينتون kinetic becomes negligible in eliminating the drug, while the other parallel pathway is first order kinetic. Okay, what we will do now is we'll stop at this point, and inshallah in our next session or part we will talk about how to do dosing when we have a drug following Michaelis-Menten kinetic, not the parallel pathway, no, only Michaelis-Menten kinetic اللي هو saturated metabolism. Okay, we will talk about this in next part. Thank you, and as usual, if you have any question, please do not hesitate to ask me. Bye bye.